About 1/3 of maternal mortality death can be prevented if women seek proper family planning methods. But the poor access to these services, public misconceptions, and the limited involvement of male partners are some of the constraints that frustrate successful rollout. Allegations that simple surgeries are carried out by unprofessional medical officers are baseless, since all the clinical officers are allowed to take such surgeries and are qualified to do so.
97% of the women who received a service from them said that they would recommend this service to a friend. This complication rate, which was very low in Uganda, shows that Ugandan clinical officers in fact perform surgical methods of contraception at least as well or better than mid-level providers in other countries.
The study, titled Evidence to Action, explored the safety and acceptability of clinical officers performing tubal ligation in rural areas. It revealed that only 2 of every 500 women who seek these services get complications in Uganda. This figure is relatively low compared to other countries where complication rates go way beyond that. In Uganda, natural family planning methods such as moonbeads, condoms, pills, injection, intrauterine methods, IUDs, and the vasectomy in men are more adaptive. However, the number of people who seek these services has continued to drop following the increase in public misconceptions based on imaginary threats.
Many of the women escape from their families without knowing, so that they circumvent the husband's influence. So if at all they have it to do it every month, it makes that work very difficult. Yet if at all they get IUDs, they have less side effects, and then it is more permanent than having an injection on a monthly basis or contraceptive pills.
The study calls for improved access to family planning methods, since about 30% of the women in Uganda are ignorant about these services. The report further highlights that some of these services should be extended to health centers, where most women seek health services.
The government in policy already approves the provision, but has not yet implemented this. We feel that this study, which we conducted at the request of the Ministry of Health, provides the evidence that we need that this can now be rolled out safely.
Stakeholders further agree that, though family planning guidelines have been incorporated in most policies, little has been done in terms of implementation, and this could be the reason why the campaign still faces public resistance. Zahra Namuli, NBS Television.